Can you briefly just tell me what exactly AIDS is?
Well, AIDS is the name of the disease.
AIDS is a disease.
AIDS is the disease.
AIDS is a new disease.
There isn't a disease. There's a lot of diseases. They're all under the same ridiculous umbrella, the disease, right? As long as we look at it as a disease that we can cure somehow by understanding how to kill the thing that causes it, we're missing the point. Totally. That's the big problem. They called it a disease. They said they're dying of a disease.
Simply spoken, if you have tuberculosis, an antibody against HIV, then we call it AIDS. If you have tuberculosis, no antibody against HIV, now we call it tuberculosis, as we used to. It's an old disease under a new name when we find antibody to the virus.
When I saw my first AIDS patient, this guy was actually suffering from lymphoma. He has so-called Burkitt lymphoma. And all of a sudden they told me, my colleagues told me, well, this guy has got AIDS now. And why he's got AIDS now? I see he's suffering from lymphoma. Yeah, well, he reacted positive in the HIV test. And I thought a while and said, well, okay, but it's not a new clinical disease, it's still a lymphoma. So everybody was talking about the big AIDS epidemic at that time, and now we have the first AIDS patients here. But I said, well, for me it's not an epidemic in the classic sense. For me it's an epidemic of a new test. And that's what we know now was one of the problems of the HIV/AIDS epidemic, that 29 of old diseases are now called AIDS if you have antibodies to HIV.
It is very deceptive to give a new name to old, well-known diseases on a scientific level, and it is not at all helpful on a clinical level, because we need to treat the underlying disease.
I mean, that's a definition, you might say. It's a definition to say that when you have HIV, you know, we call the immune deficiency AIDS. I mean, it's just a label that we use. Like I've said, there are other ways you could produce a condition that looks like AIDS, but they too will be some source that causes a severe defect in the immune response.
Immune systems have been compromised throughout medical history. You know, and there are certain conditions why they get compromised. It wasn't one factor ever. You know, it's a woman in the Sahara who gets a disease called SLIM, which is now called AIDS. Is she getting sick for the same reason that a man who was in the mine shaft in 1984 fucking his brains out comes down with a... Is it? Well, I would suggest to you, no. They're not the same conditions. But what do they have in common? What do they have in common? That question's not being answered because it's a virus. It's a virus.
AIDS is by definition acquired immune deficiency syndrome. We have known the major and actually all of the sources of acquired immune deficiency for 50 years at least, maybe 100 years. The leading cause of acquired immune deficiency around the world is malnutrition. You get malnutrition, you can come down with any and all of the AIDS-defining diseases. It's documented. Another source, and that's one of the leading causes of AIDS, pediatric AIDS in the United States and the Western world, is malnourished premature babies. This was known even before AIDS, before 1981. They were generally premature babies. They don't have a functioning immune system. They come down with pneumocystis cranii pneumonia, for example, AIDS-defining disease. Or drug-addicted mothers. 80% of the mothers who have AIDS babies admit to using recreational drugs during pregnancy. Those drugs can cause AIDS-defining diseases. The other group of people who are well known to get acquired immune deficiency are chemotherapy patients. People who are taking chemotherapy for cancer. They come down with the same diseases that AIDS patients do because the chemotherapy destroys the immune system, at least depresses it, and you can actually wipe it out completely if you do it long enough. And they come down with AIDS. And then the third basic group that comes down with acquired immune deficiency, organ transplant recipients, people who get kidney transplants, liver transplants. They are given drugs like cyclosporin A intentionally to depress their immune system so they don't lose the liver and don't lose the kidney. and they come down with AIDS-defining diseases. And when the physician sees it, he knows why, and they reduce the level of these drugs. The only thing that happened new as of 1981 was not the diseases, it was who was getting it. As of 1981, in those days, in the early days, it was 100% were gay men between 25 and 50. It was who was getting that was new, not the diseases themselves. And it turned out that these gay men that were coming down with pneumocystis carinii, Kaposi sarcoma, cytomegalovirus, and so on and so forth, had a history of chronic drug use, heroin, cocaine, amphetamines, poppers, and that sort of thing. In fact, 98% of all AIDS cases in the United States and Europe have a history of drug use. 2/3, roughly, are gay men. 1/3, the CDC says, are IV drug users, or a euphemism for heterosexual drug users. We have about 1% annually of hemophiliacs. They come down with the AIDS-defining diseases before AZT, before the introduction of AZT, due to the proteins that they had to inject, factor VIII, to keep them from dying of hemophilia. Well, chronic injections of protein also cause depressive disorders. In fact, they can lead to the symptoms that are indistinguishable from AIDS.
I was there at the beginning of this crisis. You know, I have stayed involved in this crisis, and I have tried to help people live. I think more people have died because of the theories that have been promulgated about the cause and the treatment of AIDS than not. And I think the quality of the living of many of these people who depended and trusted the kinds of drugs that were put forward and the theories that were put forward is cruel punishment. The quality of their lives was very poor.
AIDS is not really a disease, is that correct?
The term AIDS was coined early on, and it meant acquired immunodeficiency syndrome. In medicine, a syndrome is a series of symptoms that are thought to be related to each other.
In fact, they have so many diseases in there, it's, I said, it's almost absurd. It's a bewildering combination of things. Many of them have nothing to do with each other. I said dementia and diarrhea. What do they have in common? Absolutely nothing. Nothing. I mean, one is something in your head, and the other is something in your ass. You know?
They're a kind of infections, almost all of them, that exist out there. It's not like only a person with AIDS would get them, but only a person with a severely damaged immune system gets them.
No, they are not. No, about 2/3 of them are immune suppression-related diseases, like the microbial AIDS diseases. All the microbes benefit from a defective immune system. But dementia, Kaposi sarcoma, or lymphoma, or cervical cancer, or weight loss are not consequences of immune deficiency. They have nothing to do with it.
They don't require immune deficiency to
No,
cause them?
no.
There's a common belief that it's immune suppression is involved. Harold referred to it. Our data would argue it's the opposite, that it's immune stimulation. That you can have Kaposi's epidemiologists tell me in the absence of immune suppression.
What about cervical cancer? Because that doesn't require immune suppression either.
Yeah, no, that was really I still think, and I've actually published that does not appear to be related to HIV infection. Though in 1993 it was added to the list as an AIDS-defining illness. TB was a real tough disease for us because tuberculosis occurs in both immunocompromised and immunocompetent people. And so actually it wasn't one of our initial diagnoses to be AIDS, because more than half the cases in the literature up till then were in immunocompetent individuals as opposed to immunosuppressed. So that didn't make our list of diseases till about 1987.
The blood test was released in commercial use.
Yes.
Did the CDC go back and test all the people they had diagnosed with AIDS up until that point?
No, we did not.
Realistically, you should not diagnose AIDS as acquired immune deficiency syndrome without evidence of HIV infection.
In 1987, the CDC made two mind-boggling changes in the definition of AIDS, which are in effect today. You can be diagnosed with AIDS without ever having an HIV test.
Matter of fact, the CDC acknowledges that at least 40,000 AIDS cases in the United States were never even tested for antibodies to HIV.
So,
a lot of it is presumptive.
Presumptive that there was nothing done, like in Africa. The doctor says, this looks to me like AIDS, and reports it faithfully to the World Health Organization or the CDC. And that's exactly what's happening here. There's a gay guy with Kaposi. Do we need to hear more? No. Goes to the public health office as a reported AIDS case. Do you think anybody's going to question it?
how were you diagnosed with AIDS since you didn't have the benefit of an HIV test?
Well, I had it in 1987. I had a lesion on my arm, a little spot that was raised in the color, and they biopsied it. They cut it out, and it was KS, Kaposi sarcoma.
And so the doctor told you you had AIDS?
Yeah.
Can you look at somebody and identify them as being HIV infected without doing an HIV test?
Well, I could shake hands with him and see, yes, a little fever. I could guess, yes, sweat and a little fever in his hands. I could say this is someone with some kind of infection. And of course, if it is a gay man or a heavy drug abuser, I would guess it's probably HIV.
The definition of AIDS has broadened over time. It was revised in 1985, and then again in 1987.
The definition has changed many times. The biggest change was probably in 1993, which they then, added the CD4 count and HIV, and so you could not even be ill, but if you had a CD4 count consistently below 200, you now had AIDS.
Part of the intent of changing the definition in 1993 was indeed in an effort to keep the impression in the public mind that AIDS was continuing to increase. In fact, AIDS cases that were reported to the CDC by the old definition had peaked in 1992. It was clear that they were plateauing, and based on the old definition, AIDS cases have continued to plummet.
A closer look at the Centers for Disease Control's documents reveals that AIDS numbers actually declined in 1993, but a retroactive definition change increased the estimates by more than 100%.
If U.S. AIDS cases were to cross the Canadian border, about 2/3 would no longer be AIDS because they were diagnosed in the U.S. based on the low immune cell count definition that's not valid in Canada.
I was interviewing a few people in Health Canada, and they don't recognize the 200 count. Why do you think that is?
Well, I mean, in the U.S., I think some of the reasons for it relates to the activist community were very concerned that there were a large number of folks that were HIV infected that were ill but didn't meet criteria for AIDS and thus were not eligible for certain resources. And so I think through some input from the activist community and so forth, that in the U.S. we lowered the criteria to include asymptomatic people with CD4 counts. But there are a number of countries that don't use that as criteria.
CDC felt it was important to utilize the case definition of a way of demonstrating a need for management of people with end-stage infection. And we wanted them to be, their doctors to be alert to that management need, and we wanted their insurance companies to be alert to paying for the conditions.
There were a number of people that were getting treatments for AIDS, either trimethoprim sulfa for pneumocystis, and the states were trying to recoup some of their dollars. So the definition then had to, they wanted to use the same definition for surveillance and for clinical diagnosis for reimbursement parts. So there were some politics and dollars and cents that impact almost every decision in public health, believe it or not, that started coming into play in the 90s as people were looking at how to fund these things and how to get reimbursed for.
What were they trying to get reimbursed for? What was that?
Well, for treatments for AIDS, for you know, Medicare and Medicaid and other kinds of payments. If you couldn't document that you had a diagnosis of AIDS, you couldn't get, you know, monies that were set aside for AIDS funding for clinical care.
If someone has a T cell count of 200, he's then defined as being an AIDS patient. What happens if he comes back to 2 weeks later and his T cell is 350? Is he still considered AIDS?
Well, if he was reported to the health authorities, and there is a requirement for reporting patients with AIDS. If he was reported, once he's reported, he is counted in the roles of people with AIDS. However, it really has no particular implication for him. If he is 350 2 weeks later, that's terrific. But if he is someone who needed some kind of benefits from the state that depended on his having an AIDS diagnosis, he of course does now have an AIDS diagnosis. And if he was someone, for example, who was seeking disability, it will be easier for him to get disability once he's had an AIDS diagnosis, even if it was only for 2 weeks.
So once you get an AIDS diagnosis, you're always considered an AIDS case?
Yes.
Okay.
You don't get taken off the rolls.
I knew people that had 4 T cells that did not have AIDS and who were healthy and active in the world outside. And I knew people who had 400 T cells who couldn't get out of bed. And yet the person who had under 200 T cells could get all kinds of financial and ancillary services. The person who had above 200 or 200 T cells did not qualify.
You have to remember that definition of 200 T cells meaning AIDS, that's a political definition. It's not a medical one.
That's why other countries don't use that definition, I think, because of the dollar.
Yeah, well, I mean, you know, everybody's got to make their own, to fit their own needs. And so, yeah, the CDC, working with Health and Human Services, and Congress and others have, you know, these all come into play.
It's a lot more complicated when you get to the surface, eh?
Yes, yes it is. Yes it is.
We now know that AIDS really represents a severe breakdown of the immune system. It's really the end stage of HIV infection. And all of the conditions that occur at the end stage of HIV infection, the serious ones, are included in the case definition. But the real definition of AIDS is a severe breakdown of the immune system, which can be measured in the laboratory.
You can be perfectly healthy with a T cell count of less than 200, but it'll still be an AIDS diagnosis.
So I was told you can be actually healthy with CD4 count of less than 200.
That's correct. You can be.
When I got my CD4 count and it dropped below 200, I sort of freaked out. It was, and that freak out lasted, I would say, about 20 minutes. And a friend then picked me up at the doctor, and I was crying, and he said, "What's wrong?" And I said, "I have AIDS." And I was just sort of freaking out, and he said, "Well, how do you feel?" And I sort of brushed back the tears, and I said, "Well, actually, I feel fine." And he said, "Then what's the problem?" And it was almost like a light bulb went off, and I was like, "Oh, I guess there is no problem."
The CD4 surrogate markers, which are really, they're absolutely of no use. They're no better than a toss of a coin to determine the outcome of a patient, but the physicians have gotten so used to doing it, they still do it by habit, even though it's meaningless. It's worse than meaningless. It scares people to death when they get these numbers.
I went back on medication when the doctor said, "You have 222 T cells." I could have passed out. I was like, "Oh my gosh, I'm only 22 T cells away from getting AIDS. I have to take medicine."
I stopped doing the T cell counting because to me it's a very dangerous, slippery path to get into. And that's what happens to a lot of people. They're perfectly well, they feel just great, they're not sick, they've never had any condition, and just because one day the doctor says, dum-da-dum-dum, 200, you fell below 200. Ah, death sentence. And then you put it in the mind, and then that's it. You know, you really are a goner if you start believing in that stuff.
I think we absolutely focus on lab results too much. And not just with HIV and AIDS, with anything, with cholesterol or anything, but certainly with HIV and AIDS, it's almost like we don't see the whole person. You don't see a person who is healthy, clinically healthy, as in not experiencing disease. You see a low CD4 count or a high viral load. And I think when you base treatment decisions solely on those numbers, which can fluctuate based on God only knows what, you know, how much sleep you got the night before, what your diet is like, what your stress level is like, what you believe about your HIV status, the pollution that you breathe in, the stress, like white coat hypertension, just this, you're afraid of needles, for God's sakes. All of these things, and God only knows what else, go into affecting your numbers. So to solely base treatment on a low CD4 count alone, without the presence of other obvious signs of immunodeficiency, to me never made much sense.
Did your doctor pressure you to get on meds as soon as you hit 200?
Yes. Yeah. When I first tested positive, it was a point in HIV treatment which is commonly referred to as hit hard, hit fast. And so as soon as a person tested positive on an antibody test, it didn't really matter what your numbers were, viral load or CD4 count. It was you get on a really strong regimen of anti-HIV medicine, and the thought was to whack the virus as hard as you could immediately, and it wasn't really even dependent on lab results, let alone on clinical health. Over time, that's thankfully changed quite a bit, but certainly when my numbers started to go below 200, and even when they were the highest my numbers have ever been have been at 300, there was a huge amount of pressure. Like, if you don't go on these meds immediately, you're in big trouble, And it seemed like every time I would go to a different doctor, they would pull a different card and say, do you want to go blind with CMV retinitis, or do you want to die of pneumonia, or do you want to get AIDS-related lymphoma, and it just, to me, it seemed like scare tactics. I mean, you want to educate people, but it didn't seem to be particularly productive. I think once I really took a stand and I really said, look, this is my policy. I will decide on treatment based on clinical health alone, and maybe, take into consideration my labs, but not have it be exclusively that. That's when they started to calm down and say, okay, he's going to do his thing when he's ready. And the past few years have been considerably better, and I found a nurse practitioner who I really get along well with, who deeply respects my opinions, and she really doesn't try and pressure me at all. And so I'm very grateful for that.
Prior to 1997, the CDC provided a list of how many people were diagnosed with each AIDS-defining disease each year. They also provided the number of people who were diagnosed without any disease at all, just based on low CD4 immune cell counts.
During the time that the CDC continued to report the opportunistic illness that triggered the diagnosis of AIDS in patients, the vast majority were due to T-cell counts of less than 200. For example, as I recall, in the year 1993, I believe about 66% of the AIDS diagnosis for that year were due to low T-cell counts. 1994, 95, sometimes, I think once the numbers popped up to 80% of the diagnoses of AIDS in a year were due to low T-cell counts. In other words, perfectly healthy individuals being tagged as AIDS patients, thereby inflating the AIDS statistics.
Table 12 was the breakdown of the number of AIDS cases over that year according to the diseases, over the various definitions of AIDS. And then Table 11 was the breakdown over a period of years, how it changed for the various definitions over a period of years, 4 or 5 years. And both of those tables clearly showed this divergence, this separation between people who have antibodies to HIV and people who are actually sick. So you couldn't keep, the CDC could not keep that going and have that divergence increase over time and then claim that AIDS is not going away. They don't want to say AIDS is going away because then they're out of business, pretty much.
In 1997, this delineation stopped. Okay, in other words, we no longer know, we know how many AIDS cases were reported to the CDC, but we no longer know the breakdown of the illnesses that cause these diagnoses.
All of these problems are solved by not reporting what the diseases are in the first place. Then nobody's going to pick them apart on the basis of what's really happening anymore because we don't see it. Right. We hear from the CDC it's AIDS, and we assume that they have found HIV, and that's all you get. Okay. And nobody gets the odd idea, could it be Kaposi, which is now caused by something else? Is it diarrhea, or is it cervical cancer in a homosexual? How could they get cervical cancer? Obviously it's not an AIDS-defining disease, only for women. Oh, the virus causes one thing for women and something else for men. I see, all right, isn't that strange? You wouldn't have none of these questions when you hear AIDS and HIV.
AIDS, by the old definition, was disappearing rapidly. And as I mentioned before, when you look at the graph of AIDS exploding from 1982 up to 1992, and you see this tremendous rapid drop-off up to 1997, where we no longer have any data to distinguish between old AIDS, in other words, AIDS that is associated with real illness, and new AIDS, which is the T-cell count-based AIDS. So we see this inflation of total AIDS now. And again, even total AIDS is dropping off. But I think it was embarrassing to the CDC to see that the syndrome was almost gone. In other words, the syndrome of people that are antibody positive for HIV, also getting ill. AIDS patients don't die, HIV positives do not die of AIDS today, very rarely. The vast majority now die of liver disease.
In Massachusetts, the #1 leading cause of death among people who are HIV positive is liver failure. And I don't think liver failure qualifies yet as an AIDS-defining disease. But these people they're not counted as AIDS cases. They're just somebody who was HIV positive, given AIDS drugs, and the AIDS drugs killed their liver and they died.
I seen side effects from that right away. I was on a combination of Viramune and Comprivir. I was losing weight. I couldn't eat. I couldn't drink. And the pills that I was taking had to be taken with food. And I couldn't eat. And I began seeing liver damage. And I was taking off the medicines within a month of me taking them.
We're finding out that medications are hurting, killing people, and not really killing the virus. It's causing other problems in our clients now, and that's what's killing them, the medicine instead of the virus.
You hear a lot of doctors, you hear a lot of educators in AIDS, you hear a lot of people talk about it is probably the drugs that are going to kill us before the disease does.